Okay, so today we are going to talk about measles. So first of all, how does someone get the measles? Well, like chicken pox and monkey pox, um, it is spread, and like COVID-19, it is spread by the respiratory route. You get it by breathing it in. And there's actually recently been several outbreaks of this. Um, they had one at Disneyland not too long ago. Up in Berkeley, they also had this. Measles is extremely contagious. So, to give you an idea, COVID-19, for every one person that gets COVID-19, I want to make sure that's in my screen. For every one person that gets COVID-19, usually 3 more people get it. With chickenpox, I keep saying chickenpox. With measles, every person who gets measles, they spread it up to, on average, 18 other people. That's how contagious measles is. When you go to the doctor to give you a shot, called an MMR. Okay, what this stands for is measles, mumps, and rubella. We already covered mumps, if you recall, when we were doing the respiratory system. That was when you got your cheek got really big. All right, so this is measles here. So measles, mumps, and rubella. So this should say in. It is in the MMR vaccination. So like I said, when you get that, to take care of this, it's also something that usually requires a booster shot. After a number of years, it goes away. The number of cases has gone way down on this. Okay, it's gone way down due to the vaccination. But this is a condition that it's pretty dangerous if you're very young or very old. So dangerous, let me see if I can get one more line out of this marker. Dangerous to the very young or the very old due to weakened immune systems. Very young and very old. Okay? Sometimes I'm going to switch markers so you'll notice there's a change in color here. Sometimes what will happen is people will get earaches with this, so it can be accompanied by earaches. And it's not uncommon because of the fact that this is a respiratory infection. It's not uncommon for people to get pneumonia with this also. And if you recall, we said pneumonia was when we had inflammation in the lungs. And once again, with COVID-19, we're hearing a lot more about pneumonia also because a lot of people are getting it. It can cause encephalitis. A lot of viral conditions, because they get in the blood, will go up to the brain and cause encephalitis. Okay, so encephalitis, once again, is inflammation of the brain. Okay? Usually what happens is it gets into the respiratory system. So it gets into the respiratory system, and then, as you know, into the respiratory system. And then, as you know, from the respiratory system, it goes into the blood and gets into the blood. Once it gets into the bloodstream, it can go anywhere. Because now it's in the body, right? So it can go anywhere in the body. Okay, but what this will cause, and I'm going to try to show a picture of this at the end of this video. What this will cause is a macular rash. And if you recall from earlier in this chapter, a macular rash, we said a macular rash or a macule is a flat red spot. So it causes a macular rash usually within 2 weeks after you become infected. Okay? So where's the rash occur? The rash is going to be on the face, same areas as chickenpox. The rash is usually on the face. The trunk. Remember, the trunk is basically your chest and stomach area and your back and extremities. So you wouldn't really see this on your legs. And I don't know why. And just in case you're wondering, extremities is your arms here. Okay? Usually you don't see this on this leg. So one of the distinguishing factors about this is something called Koplik's spot. This is a characteristic sign of measles. And basically what Koplik spots are is they are red, white, and blue spots that are in the mouth. Okay, so the red spots with central blue and white spots. I'm going to put specks. I don't think it really makes a difference, but you have specks that are in the mouth. Okay, and then these are used to diagnose the disease. Remember, DX means diagnose. So it's going to be used to diagnose measles. Okay. And so for the most part, that is measles.